Grete and I as we move forward. So what is risk identification? Well, we've talked, it's really injury epidemiology, isn't it? You've heard lecture after lecture here showing diagrams of what are the injuries in handball and how do they occur, and what's the risk to this type of player and what's the risk to that type of player, and at that level, and at males and females, and so on and so forth. To have data on risk in your teams for your players. So what you will hear coming out of the talks here is how we think it may be important to establish your own injury recording system so you actually know what the risks are to your players with your coach and with your competition program, and not just read those papers from the literature, which you should certainly also read. So the question is then, what are these risks in handball? And this, I'm showing you the next slides, not because I think necessarily the data there is very accurate. Again, I think you should get your own data, but it's more about the principle, how you think about this. And this is how you can depict injury risk across any sport. So this has two axes. This axis here is how likely is this to happen. So this here are the things that occur all the time, and these are the things that occur very rarely. And then this is the severity of that injury or illness or occurrence, from insignificant to catastrophic up here. And I will not claim that this is accurate for handball. We may discuss where you place these injury types here, but I'm certain that you will agree that bruises will be a certain consequence of every match, more or less. You will have bruised players every match. So it's down in this corner where it's almost certain to happen, but usually the consequences are insignificant. So that's why we have it down here and not up here, okay? Sudden cardiac death, we heard about that this morning. It happens in handball, but it happens very rarely. But it's a very severe, oops, what's happening here? It is a very severe occurrence. So that's why it's up in this corner here. And then I've placed maybe randomly ACL injuries, not that common, not in the male handball population at least. Hamstring strains, maybe just as uncommon, or somewhere down here. Ankle sprains, more common, we know that. That's a rare occurrence. Now, one of the as we're here, as we move forward, one of the limitations for the epidemiology literature is that it focuses on the acute injuries. So overuse injuries are often not recorded, and therefore they do not come out in the tables that you read, in the papers that you read. So you may get the wrong impression. So I've thrown here what I think may belong here in terms of overuse problems in male handball, with low back pain, something that I think is fairly common, with shoulder pain that we think is very common, and among the boys, jumper's knee or patellar tendinopathy as a very, very common problem in youth elite and elite sports. But if we change gender, this changes. So certainly ACL injuries are much more common. So if we're talking about the women, then ACL injuries would be over here. So what is the point of what is the principle of this diagram? Well, the principle is very easy. The more yellow the color, the more you need to focus on that. So you don't really need to spend much time on those occurrences, on the light yellow area here. Where you should invest your money and your time would be on the darker yellow here. So if you're involved in female team handball, then certainly ACL injuries should be a focus areas. If you're involved in male, then perhaps shoulder problems should be your main focus area, or jumper's knee should be your main focus area. And for the women, again, I've thrown in these three other just to show that there's a difference, there's a gender difference here as well. And the main gender difference being that I've moved jumper's knee from over here to over here because it's a much rarer problem among female players than among male players. All right, it's about understanding risk. So the principle here is about understanding risk. And Grete will later talk about how you can do this in your setting with your team. And the illustration here is from work we've done with Olympic athletes in Norway, with a program that she will describe in detail, and where we, for each player, can get their injury history depicted like this over time. This is the preparation period going into the Olympic Games in London, and one athlete and the injuries and illness problems that that athlete had. If you can collect data at that level of detail, you will really know what's going on in your club, in your team, in your sport. The next step is season analysis, and I'll just touch on that briefly. What do I mean by season analysis? What I mean is a formal review of your plans, and this obviously needs to be done with the coaching staff, with the manager of the club, of the team, all the fitness coaches and so on, reviewing the program of the season, and before you start, trying to understand where are the risks involved with this program. Again, it helps if you know what happened last year, because then you can learn from the mistakes you made last year. And this would be an example of a very, very rough example, just to give you an idea of what this is. This is the season. This is the various components of the training program, if you like. And I've highlighted one example here of a team in the preseason, Norwegian team in the preseason, going to a training camp in Spain, and there are some particular risks possibly associated with that 1-week training camp in terms of both acute overuse and overuse injury occurrence. That'll be all about season analysis, but I think that is a key component of a risk management program. Then the next is, well, what about each individual athlete? And the pre-participation exam or the periodic health examination, done pre-season or done post-season. My preference would be to do it post-season, because then you still have time to act on the findings that you have. If an athlete has a problem, you know about it. It's 2 months until the competitive season starts. You still have time to do something about it. If you do it just a week before the season starts, you are limited in what you can do with the problems you identify through a screening like this. And I will discuss this in more detail as we go on. Just quickly about the main purposes of the periodic health examination. And those who want to read more about this, there is a consensus statement published in the BJSM from a working group within the IOC that have said something about this. But it includes a comprehensive examination of 2 things: the health of the athlete currently and potential risk factors for injury or illness in the next instance. It's seen often as the entry point into medical care for the athlete, and I'll get back to that. And it may be a tool to continuously monitor the health status of the athlete as you move forward. The main issues are, and one of the key messages coming out of this will be related to, well, how helpful is this in terms of identifying health problems among athletes? Or how helpful is this in terms of predicting who will become injured or ill based on the screening exam and the various tests that we do in that type of a setting? The question is, essentially, can we screen for future injury risk? And I will get back to that later. Here at Aspetar, we have a very comprehensive screening exam that all athletes in the professional leagues, football and so on, handball, volleyball and so on, go through before they can play. It includes a number of components here, probably the most extensive exam anywhere in the world, and also with a very extensive musculoskeletal screening component. Not everyone can do this, and the question is, how helpful is doing this? And I'll get back to that later today. So the final part is about risk acceptance or mitigation. And risk acceptance, I just talked about. Another way of accepting risk is if you are a top team and you have a lot of money, of course what you can do is buy insurance. And how do you buy insurance if you have a lot of money in football? Well, you get the 2 best players in the world for each position. So if one gets injured, no problem, we can just play the other guy. No. If you can't afford that, then, and this is what the top teams do, right? They have 2 great players on each position, so the team is not weakened by injury. It's called buying insurance. The other would be risk mitigation, in other words, injury prevention, and we will talk more about that as we move forward. So this was basically my introduction. Not all of this has been tested in science. The first step we know can be done, that's epidemiology within the team. Anyone can do that, that's easy. The second step, season analysis, very little is written about it and no science is available on it, as far as I know. The third step I will discuss later. Now, is it possible to identify the athletes with increased risk for injury, and how do you do that? It's a question I'll address. And then, can we buy insurance? Yes, if you have money. Can we prevent injuries? Definitely we can. And Grete and I will be discussing that at length. If you want to read more about this model and this way of thinking, there is a handbook in the IOC Handbook series. There's one handbook on sports injury prevention. And one of the chapters there is where I've written, along with a colleague, or described this model more in detail.